let's talk about sexual function and breast cancer. I talk about this topic a lot because so many patients are impacted in their sexual function after going through breast cancer treatment, but often they're not talking about it with their doctors, or they're embarrassed to talk about it, or no one asked them, so they don't feel comfortable bringing it up. So number one, talk to your healthcare team. Number two, it's important to note that all breast cancer treatments can impact sexual function in some way. Chemotherapy, breast cancer surgery, radiation therapy, endocrine therapy, all can impact it. So it's not just one thing. Very often when we talk about sexual function, we're kind of jumping right into vaginal dryness, but it's so much more than that. And one of the things that I haven't talked too much about is hypoactive sexual desire disorder. This is a condition where people experience either an absence or a reduction in sexual desire, and that causes them personal distress. Now, there is a drug that is already approved called flibanserin, or Addyi. It's a drug that targets the serotonin receptors, but it's never been studied in patients with breast cancer, and so we weren't sure if this is something that was effective or safe to use. In June, at the American Society of Clinical Oncology annual meeting, a group of researchers presented a study, small study, but they tested the use of flibanserin in patients with stage 0 through 3 hormone receptor positive breast cancer. Participants had to have been on endocrine therapy for at least 3 months, and all forms of endocrine therapy were allowed. And they only had 37 women, so it's a small study, but it's a start. And what they found was that when participants took flibanserin nightly for 24 weeks, and then they followed them for 52 weeks, people who took the medication experienced an improvement in desire, arousal, orgasm, lubrication, sleep. And when they stopped taking the medication, some of those levels did decline, but still were higher than the initial baseline levels. Side effects of flibanserin do include feeling a little bit dizzy, drowsy, or lightheaded, so that is something to keep in mind. And we need a large clinical trial looking at the use of flibanserin in patients with breast cancer. It's approved for people who do not have cancer, so we kind of need more information in the population of people with cancer, but it is a potential option. At least having some data is important, and I would talk to your doctor about if this is something that may be an option for you. Let me know what questions you have about this medication or sexual health and cancer in general.